Good morning. Myself, Dr. Vishnu A.S., Assistant Professor on Contract, Department of Philosophy. Today, we are going to discuss about euthanasia. Actually, what is euthanasia? We all know that euthanasia is a part of concerned with medical ethics, which of course is an area under applied ethics. Before we going into the detail, let us look what ethics is. We all know that ethics is the study of right conduct, what is good, what is bad and all. When coming to an applied level, applied ethics is coped with real life situations, well-being of people, animal, nature, of course the entire biosphere. We know that, or we can see that there is a link between the theory and practice. Of course there is theory related to ethics, and on a practical side that is a practical ethics is there. So there is a link between theory and practice. What is the aim of this practice? It is aimed to the prolongation of life, the goodness of life. It is actually an area of interdisciplinary study which concerns about ethical inquiry. What is the nature of applied ethics? It deals with value aspects of relationship, applied in the fields of profession, business, medicine, environment, science and technology, cybernetics, media, etc. Applied ethics is the philosophical examination from a moral standpoint of a particular issue in private and public that are matters of moral judgment. That is, the applied ethics is the philosophical examination of the moral standpoint. That is the main point. It is thus the attempt to use philosophical methods to identify the morally correct course of action in various fields of human life. We all know that the applied ethics is distinguished from normative ethics, which concerns that what people should believe to be right and wrong, and from meta-ethics, which concerns the nature of moral statements. We already said that in what area this ethics is applied. We can see that in healthcare it is applied, in social scenario it is applied, in the biomedical and behavioral research area it is applied, in genetics, in reproductive technologies, organ and tissue transplantation, death and dying, population, environment, etc. So we can see that this application level of ethics is in almost all fields of our day-to-day life. We all know that there are 4 ethical principles: autonomy, beneficence, non-maleficence and justice. Actually, based on these 4 principles, all the applied ethical principles or applied ethical aspects are derived. Of course, the first 2 principles are mainly utilitarian in nature, and the last 2, that is the non-maleficence and justice, are deontological. It has been claimed that the principles are general guides that leaves considerable room for judgment in specific cases, and that provide substantive guidance for the development of more detailed and rules and policies. So coming to medical ethics, we all know that medical ethics is concerned with the values in healthcare. Actually, it is one of the major areas where ethics has a practical sense. We all coming to the fundamental values. These are some of the fundamental values which are analyzed in medical ethical arena. First one is the preservation of life. Second one is the relief and suffering. Third, the cure of disease, care of the person, prevention of disease, and promotion of health. These are the major areas of ethical concern. Coming to our main area, euthanasia, we are going to discuss what is euthanasia, what are the kinds of euthanasia, arguments in favor of euthanasia, arguments against euthanasia, and euthanasia in India. These are the areas which we are going to discuss in our class. What is euthanasia? We all know that the most recent medical advances have focused attention on the special problems created by human power over life and death. In the domain of bioethics, the problems assume the basic questions of this: right to live and right to die. These are the basic questions which give prominence to ethics in medical arena. Coming to the etymology of the term euthanasia, where does it come from? It comes from the Greek word eu, which means good, and thanatos, which means death. It means death that benefits the person who dies. According to Buddhism, Indian tradition, euthanasia is rejected because ending of life is thought to be wrong at any time. Not only Buddhism, in major Indian philosophical context, euthanasia or ending of life is considered as a bad thing. Actually, it is not ethical in this sense. In some countries, euthanasia is legalized, and in some other, it is not. In US, it is not legalized, but countries like Belgium, Netherlands, and Switzerland, it is legalized. Actually, euthanasia is a system by which an easy, painless death is brought about to persons who are suffering from incurable diseases. It is defined as deliberately terminating the life of another person. In the case of euthanasia, the act results in death of a person. Actually, it is assisted in this sense. It is with the help of some other persons, maybe a physician or nurse. But it differs from a PAS, that is a physician assisted suicide, that we will discuss in the end of this chapter. Coming to the kinds of euthanasia or types of euthanasia, there are many kinds of euthanasia. Euthanasia may be active or passive, or again it may be classified into voluntary euthanasia, involuntary euthanasia, or non-voluntary euthanasia. Coming to active euthanasia, the killing of the person is direct. That is, the patient suffering from pain or some other sort of discomforts is administered lethal medicines or is killed by direct means. That is active euthanasia. When coming to passive euthanasia, the life supports or the medicine which has been prescribed for the a patient is withdrawn, and thus by giving a chance for the patient to die passively. Then coming to voluntary euthanasia, voluntary euthanasia involves patient making a voluntary and persistent request that someone actively cause his or her death. Then involuntary euthanasia, it involves the killing of a patient against his expressed wish. Then coming to non-voluntary euthanasia, it involves someone killing a patient who is unable to express his wishes. That is, a person in a vegetative state cannot express his wishes. So in that cases, it is considered as non-voluntary euthanasia. So coming to arguments in favor and against euthanasia. So there are, for a point, there will be always in favor factors and opposition factors. The favors supporting the euthanasia are prevention of cruelty, the agony of relatives, the most important, saving of pain of the patients. The patient is saved from the pain and distress he is experiencing. So coming to the arguments against euthanasia, sometimes miraculous recoveries may happen. Sometimes it leads to the killing of individuals. Slippery slope argument between voluntary and involuntary euthanasia is one of the major point. It permits the killing of incurable and useless. Practice of euthanasia may cause unwanted horror or fear in the minds. So these are the arguments against euthanasia. Physician assisted suicide. Apart from euthanasia, PAS is something different. In this case, doctor only provides the means for the patient to kill himself. PAS is normally permissible in these cases. First one, the competent patient is terminally ill. If he makes a voluntary request for it, if it is the patient's best interest, if it is the only way to relieve pain and suffering for him. PAS is permissible when the death of a patient is lesser evil and continued life is a greater evil. It violates the physician's duty to heal. PAS is only done if these conditions are met. If the diagnosis of terminal illness is confirmed, patient must be suffering from an unbearable condition. Patient must be informed of the diagnosis of his condition. Patient must not be suffering from depression. Patient must make a voluntary request for death. Patient dies as a result of PAS, doctors must report it to authorities. PAS is considered as a form of giving treatment. Doctor is morally permitted to assist a patient. PAS is permissible when death is lesser evil, continued life is greater evil, death is in the patient's best interest. Euthanasia in India. When coming to euthanasia in India, the major point to discuss is whether it is legalized or not in India. In India, on March 9, 2018, the Honorable Supreme Court legalized passive euthanasia. Only passive euthanasia is legalized. To opt for passive euthanasia, a patient has to give consent through living will. This landmark decision was made as a part of famous Aruna Shamba case, where she was in a vegetative state for 42 years. To conclude, we all know that right to live with dignity is a part of our fundamental right, that is, right to live. It is mentioned in the Constitution of India. This right includes that a person has the right to live with dignity until the end of natural course of life. This right also includes dignified procedure of death. Therefore, we can say that euthanasia is not an evil, but a necessity in certain cases. Thank you.